Welcome back to the Poultry Doc Podcast. I'm your host, Dr. Blayne Mozisek. Each week, we bring you board-certified veterinary guidance to help your flock thrive. Let's head to the coop. Hey, I'm Dr. Blayne Mozisek from thepoultrydoc.com. Thanks for joining. Today, we want to talk about eggshell quality and eggshell thickness. We've had a lot of questions recently about some of the things that may influence it, and people asking how they can improve their eggshell quality. Usually it's related to soft-shelled eggs, right? And so there are several things that can influence the thickness of the eggshell. One, just as birds get older, their eggshells inherently just become thinner. The egg gets larger, right, as hens get older, and they only produce so much calcium or only lay so much calcium on that egg. Doesn't matter how big it is, and so as it gets bigger, there's only so much calcium, so the calcium has to get thinner, so the eggshells become thinner. So that's a normal part of aging in a hen, and it's expected. Disease can also influence eggshell quality and the thickness of the egg, and egg quality as well. But basically, some diseases are going to impact the shell gland, or the part of the reproductive tract that lays that calcium down to form the shell. It's going to impact its ability to perform that function. Some diseases will increase the rate of transit through the reproductive tract and also lessen the amount of calcium that's on the egg. So there's definitely disease processes that are involved sometimes with eggshell thickness. And then stress, right? Any sort of stress, think about, a storm coming through the night, or, some sort of trauma where she jumps down. That can also impact eggshell quality or eggshell thickness. We can get thin-shelled eggs from that. And then there's calcium, right? So calcium is obviously the main component, the component of the shell, and it needs to be an adequate supply in order to form that good thick shell that we want, right? The bone in a chicken actually acts as a sponge, so to speak. So the shell gland is going to need that calcium, and there's cells within the chicken. They're called osteoclasts. We have them too. Basically, these cells, when the calcium level gets low, circulating calcium in the blood, we call ionized calcium, gets low, those cells are stimulated to pull calcium out of the bone. So basically they go into the bone and they break down that calcium, they mobilize it, turn it into ionized calcium, and then the shell gland picks that calcium up, lays it down into the shell. So how do we provide that extra calcium to birds? Most people are going to do it through either the feed they feed, right? So we're thinking a layer feed that's got 3 to 4% calcium. That's the normal quantity in a layer type diet. And that calcium in that diet's often finely ground, right? Because it's in a pellet, it's in or a crumble potentially. And so it's ground up in that process of blending feed. And so there we've got really small particles of calcium, which is fine, it's still calcium. But there's some things that we'll talk about here in a second. The particle size really makes a difference. So if you're not feeding a layer diet, then you're most likely feeding an all flock diet. So those are different in that they don't have supplemental calcium in it. So they're going to have the standard amount, less than 1% of calcium. And so then we need to supplement, right? So we're supplementing calcium, and we can do that in a couple ways. One is very common around us, is crushed limestone. So here in Austin, it's referred to as Austin chalk. It's very plentiful, but it's just crushed limestone. The main part of this is calcium carbonate, which is the same thing in like crushed oyster shell, right? So calcium carbonate is what that chicken's going to utilize or pull the calcium from to put down in the bone or put down in the eggshell. Some chickens will eat it readily. Some people recognize that some chickens don't want to eat it, right? So there are several types of supplemental calcium. We've got crushed oyster shell, we've got crushed limestone. It's very prevalent here in Texas. We've got Austin chalk. This is crushed limestone, and they provide the same source of calcium. So calcium carbonate is going to be the main mineral that's in both crushed limestone and that crushed oyster shell we give, and that provides the calcium that they need. What happens is this bird is going to eat this crushed limestone, and that is essentially is going to be slowly digested in the tract or dissolved. So as it's dissolved, it's laid down into the bone, right? So that calcium, remember, is the sponge, essentially. Think of it as a sponge for calcium. And so these cells are going to lay that calcium onto the bone or into the bone, and then when it's needed later during shell production, those osteoclasts we talked about are going to pull that calcium back out of the bone and put it into the shell. So there's this constant ebb and flow of calcium in and out of the bone. One of the ways we can mitigate that, because it's not great pulling in and out of the bone all the time, is with large particle calcium. And this is where we talk about the particle size really makes a difference. What happens is the chicken eats the large particle limestone, it goes through the crop into the gizzard, and it can't pass the gizzard until this is at a really reduced, very fine particle, right? So the gizzard has essentially like it's gated. So only small particles can leave the gizzard if everything's functioning appropriately. The end result is that these large particles of calcium are in there through the course of the night, right? So it's as that chicken's roosting, digesting overnight, this particle hangs out in the gizzard. And as it slowly breaks down, it's slowly releasing that calcium. So at that point of the night, she's laying down an eggshell. So it becomes really efficient rather than this being consumed and broken down and going into the bone and then out of the bone into the shell. Now we've got a constant, slow, steady stream of calcium that's available immediately to the reproductive tract, or what we call the shell gland, as she lays the egg. So the large particle calcium in this case would be preferred over like a powdered calcium, right? So it provides a more steady state, and that's what we're really looking for. And if you ask like how big is large versus small, obviously there's any, and then what I'm looking at here, there's powder to sand particle size to what I would call like, eraser type size of like a pencil eraser. So they can get relatively big and you're gonna find a mix, but that's about what we're looking for, is kind of like small pebble size, right? And that's gonna be really good to provide that steady calcium stream as she's producing that egg late into the night. So chickens, if they're low in calcium, will have this innate need to consume calcium, and they'll figure it out, right? And so some chickens may have a preference for one calcium source versus another, but in the end, if they're low in calcium, they will seek it out. Similar to iron deficiencies in humans, there's certain parts of sub-Saharan Africa, right, where there are very low iron. There's not a lot of iron, and women especially get low in iron, and they have this innate want to eat dirt, so pica, because the soil is higher in iron than other sources. And so it's not because they want to eat it, it's just they have this instinctual drive to eat dirt because it's a source of iron. So it's something that's hidden deep back in your brain. You don't think about it until your body tells you that you need it. Chickens are kind of the same way, right? So they need the calcium, they will seek it out. So while calcium is important, or critical, I would say, in egg production of a hen, there are plenty of other things that can cause thin-shelled eggs. And it's understandable that most people, when they find those thin-shelled eggs, they immediately jump to low-level calcium. It's possible, certainly possible, but there are many other factors that can lead to those thin-shelled eggs. And so changing feeds or trying to find different sources of calcium in order to improve eggshell quality is probably not the first thing you want to jump to. We've got tons of different breeds, tons of sizes of eggs and colors of eggs, and variation even between individuals. And it's not unusual, some birds just lay thin-shelled eggs. In fact, there's no level of calcium that's going to increase the shell quality or shell thickness. It's just that hen, right? Specific to that hen, and she's going to lay those. Certain things can happen over the course of her life that may impact the shell gland's ability to lay down that calcium. So there may be permanent changes into how well that calcium is laid down and how thick the shell is on her eggs going forward. So calcium isn't always the first thing to jump to. Obviously, if it's provided in the feed, so if you've got a good layer feed that's got that 3 to 4% calcium in it, or you've got calcium supplements available, it's probably something else going on. So is it stress? Is it potentially disease? Is it the hen getting older? There, again, as we talked about earlier, there are several things that can affect eggshell quality. So a good example of variation between a flock is, I was out last week, we were looking at commercial hens. So this is a house that's got 10,000 hens laying eggs, hatching eggs for broiler chicks, right? And so all the same age, all the same breed, all eating the same exact feed. And so you get to see, of the 8,000 or 9,000 eggs being laid a day, there's so much variation that goes on in that flock. And the picture that you're seeing now is a very large, misshapen egg, a soft-shelled egg in the middle, and a smaller egg on the end. Again, these are all the same birds. There can be variation that goes on day to day, or even between birds. If we were to track, that specific bird and what egg it laid every day, we could she would most likely be laying a similar egg every day. So just again, a point to show you that there's tons of variation, and not only between breeds and species, but even within individuals that are very, very similar to one another. So while we're on the topic of eggs, it's also important to remember these are a food source. And I know there are many people out there, we suffer with disease issues in our flock, and you're treating your chickens for respiratory disease or whatever the issue may be. It's always important to remember that those residues of those antibiotics are often, or most often, probably almost always, there's at some level they're deposited in the egg. And depending on what that antibiotic is or what that drug is, it could be more fat soluble, and those especially will be found in the egg. So think of ivermectin, very, very lipid soluble, fat soluble. It's going to be at relatively high concentrations in the egg. It's going to be concentrated actually in the egg yolk. So that's always important to remember. And then there are unfortunately many products that are sold into the backyard market that are not labeled for poultry at all and are actually banned in food producing medicine. Blu-Kote would be a great example. Blu-Kote is illegal to use in food producing animals. It's certainly illegal to use in your hens. Obviously you're going to be eating those, but we here at the house have plenty of eggs and we give eggs away frequently. It's important to remember there are other people eating those eggs too. So we may make the decision that we want to treat with something, and I'm not concerned about the consequences of what could potentially be in the egg, but if you're giving those eggs away to people, there are potentially residues in those eggs we have to be concerned about. Using sulfa drugs is a great example. There are many people that have sensitivities to sulfa drugs, right? Those antibiotics are concentrated in the egg too. And there are many reports of people having going into anaphylactic shock or having allergic reactions to the residues of sulfa drugs inside the egg. So that's always an important one. Blu-Kote is another one that is unfortunately sold into the backyard chicken market. However, it's illegal in food producing animals. So we don't use Blu-Kote, which the active ingredient there is gentian violet. It's been shown to cause cancer. We want to avoid Blu-Kote in any food producing animal, and especially putting it on our chickens. So we never advise to put that or any drug that's illegal into or on any of our backyard chickens. So a couple important points to remember, right? We want to make sure the eggshell quality is good, but that the internal quality is good and wholesome, and that we're not passing on things to ourselves, our family, or our friends by what we're administering to our chickens. So thanks for joining today. If you liked what you find and you learned something, always like and subscribe. That always helps. If you've got questions, go to info@thepoultrydoc.com. Send us an email there and we can respond back and help out if we need to. Check out also the Founding Feather. That's available, and we do some great stuff there, helping people out with consulting time over the course of the year, among plenty of other things. So check us out, thepoultrydoc.com. I'm Dr. Blayne Mozisek. We'll talk to you soon.